Tonight, on Legislative Review. A House committee votes on a bill to close down Washington's Rainier School and Yakima Valley School. Plus, a Senate debate on a controversial bill concerning pregnancy loss. And modifying Washington's drug take-back program. You're watching Legislative Review. Thank you for watching Legislative Review. I'm Angela Nolasco with today's top discussions in the state legislature. On Tuesday afternoon, the House Appropriations Committee voted on a bill that could have significant impact on several Washingtonians living with disabilities. House Bill 1472, which is backed by the Office of Financial Management, or OFM, would shutter down 2 residential habilitation centers in Washington, Rainier School in Buckley and Yakima Valley School in Selah. These centers provide 24-hour residential care for people with developmental disabilities. They have about 130 residents combined. Following the closures, the Department of Social and Health Services, or DSHS, will transition residents into community settings through supported living programs. At a time when Washington state is faced with a huge budget deficit, supporters say the closure would save millions of dollars. The bill would stop any new admissions except for short-term services, like crisis stabilization or respite care. It includes provisions to maintain crisis beds and respite services at Yakima Valley School post-closure, depending on available funding. Supporters say it's time to move away from costly institutionalized care and that community-based services can offer individuals a better quality of life with social interaction and integration. However, critics argue that community-based services are not equipped to handle the complex needs of those with severe disabilities who rely on specialized care. Democratic Representative Tim Ormsby is the bill's prime sponsor.
I bring this bill forward as at the recommendation of the previous and current administration and the agency, as we are in a difficult budget situation, and I think it is on the agency and them taking responsibility for the transition of folks at their at the residents' choosing of a new therapeutic placement for them.
Speaking in opposition, Republican Representative Travis Couture shared his remarks.
People will die as a result of this bill. It's not just a fact, it's also a prediction. We've seen it in other states, and these facilities sometimes are not perfect, but we actually have good ones. This isn't taxes, this isn't a budget, this isn't even a facility. This is human beings. The most vulnerable human beings in our state. These facilities were set up because we had a social and moral obligation to these people who are wards of the state. But they also have families. Families who cannot physically take care of them. And those people waited all day to say their piece on this bill. And they got 1 minute to try to save their kids. That's wrong.
The committee voted on the bill.
Mr. Chair, there are 17 ayes, 14 nays, and 0 excused.
By your vote, second substitute House Bill 1472 is reported out of committee with a do pass recommendation.
If enacted, both facilities will need to shut down by June 30th, 2027. On the House floor, a controversial bill that could change how Washington state handles pregnancy loss was debated by state representatives Wednesday morning. It proposes to remove the authority of county coroners and medical examiners to investigate deaths from known or suspected abortions, stillbirths, or premature births, unless there's reason to suspect a crime. It would also repeal the so-called concealing birth law, an act from 1909 which criminalized anyone who concealed the body of a deceased child. Senate Bill 5093 also seeks to require prisons and detention centers to annually report the number of miscarriages and stillbirths among incarcerated individuals to the State Department of Health. At the center of this debate are proponents who claim it would protect those who experience pregnancy loss from unnecessary, intrusive investigations, which they say are outdated and traumatic. Democratic Representative Lisa Parsley spoke to support the bill.
I also fear for those that do not deliver their stillborn or miscarriage in a hospital, if they fear they will be facing criminal investigation, they will not get care for themselves, and they could put their life at risk. I also trust medical professionals because I am one. You know when there's misdeeds. You know when there is something suspicious. And you also know on the surface of things when it's just, forgive me for saying this, an act of God.
On the other hand, opponents argue that removing authority over suspected abortion-related deaths could jeopardize investigations into potentially illegal actions, like unsafe abortions or infanticide. Speaking against the bill, Republican Representative Jim Walsh.
A conversation about a woman's right to choose abortion is also irrelevant to the fact set in this policy. This is about hiding. It's about furtively obscuring that there was a pregnancy, that there was a baby, and that the baby died.
The House took a floor vote.
The question before the House is final passage of Substitute Senate Bill 5093 as amended by the House. The Speaker is about to start the roll call machine. The Speaker has started the roll call machine. Representative, has every member voted? Does any member wish to change their vote? The Speaker is about to lock the roll call machine. The Speaker has locked the roll call machine. The clerk will take the record.
Mr. Speaker, there are 58 yeas, 39 nays, 1 excused.
Having received a constitutional majority, Substitute Senate Bill 5093, as amended by the House, is declared passed.
Senate Bill 5093 heads back to the Senate for further review. If enacted, it would take effect 90 days after the session adjourns. The House also debated House Bill 1422, which aims to improve the state's drug take-back program, concerning how prescription drugs are collected and disposed of from households. It would require the Department of Health to modify the fees it charges to operators of these programs. As of now, drug manufacturers set up collection sites, offer mail-back options, and organize the collection of unwanted or expired prescription medications via take-back events in communities. The program is intended to reduce the risk of drugs being misused or improperly discarded. The bill would mandate annual reports from operators, detailing everything from how much medicine is collected to how much the program costs to run. Democratic Representative Strom Peterson sponsored the bill.
This is funded by the pharmaceutical companies, but we want to make sure that we get the funding right to give the Department of Health enough staff and enough oversight to make sure the program continues to be the best in the country, keeping drugs out of the waste stream and out of the hands of people that might harm themselves.
Also speaking to support the bill, Republican Representative Joe Schmick.
This does keep drugs out of people's hands and also a place for folks to be able to get rid of drugs, get it out of their households. And so it's a good thing. I think the report done will give us some more information and insight on what's needed, if anything more. Urge a yes vote.
The House voted on the bill.
The Speaker is about to lock the roll call machine. The Speaker has locked the roll call machine. The clerk will take the record.
Mr. Speaker, there are 97 yeas, 0 nays, 1 excused.
Having received a constitutional majority, Ingro's second substitute House Bill 1422 is declared passed.
With a unanimous vote, the bill is headed to the Senate for consideration. That's it for this episode of Legislative Review. Make sure to join us nightly at 8 and 11 for your highlights on the state legislature. And follow us on social media. Have a good night.